And welcome to meeting number 11 of the House of Commons Standing Committee on Indigenous and Northern Affairs. I would like to start by acknowledging that I am joining you today from the traditional territory of the Haudenosaunee, Anishinaabe, and Chinantan nations. Pursuant to the order of reference of April 20th, 2020, the committee is meeting for the purpose of receiving evidence concerning matters related to the government's response to the COVID-19 pandemic. Today's meeting is taking place by video conference, and the proceedings will be made available via the House of Commons website. During this meeting, the webcast will always show the person speaking rather than the entirety of the committee. In order to facilitate the work of our interpreters and ensure an orderly meeting, I would like to outline a few rules. Interpretation in the video conference will work very much like a regular committee meeting. You have the choice at the bottom of your screen of either floor, English, or French. In order to resolve the sound issues raised in recent virtual committee meetings and ensure clear audio transmission, we ask those who wish to speak during meetings to set your interpretation language as follows. If speaking in English, please ensure you are on the English channel. If speaking in French, please ensure you are on the French channel. As you are speaking, if you plan to alternate from one language to the other, you'll also need to switch the interpretation channel so it aligns with the language you are speaking. You may want to allow for a short pause when switching languages. It is found in the bottom center of your screen where the globe is. Before speaking, please wait till I recognize you by name. When you are ready to speak, you can either click on the microphone icon to activate your mic, or you can hold down the space bar while you're speaking. When you release the bar, your mic will mute itself just like a walkie-talkie. Remember that all comments by members and witnesses should be addressed through the chair. Should members need to request the floor outside of their designated time for the questions, they should activate their mic and state that they have a point of order. If a member wishes to intervene on a point of order that has been raised by another member, they should use the raise hand function. This will signal to the chair your interest to speak, and in order to do so, you should click on Participants, bottom center left of the screen, and when the list pops up, you will see next to your name that you can click Raise Hand. When speaking, please speak slowly and clearly. When you are not speaking, your mic should be on mute. The use of headsets is strongly encouraged. If you have earbuds with a microphone, please hold the microphone near your mouth when you are speaking to boost the sound quality for interpreters. Should any technical challenges arise, for example, in relation to interpretation, or if you're accidentally disconnected, please advise the chair or clerk immediately, and the technical team will work to resolve them. Please note that we may need to suspend during these times to ensure all members are able to participate fully. And before we can get started, everyone can please click on their screen in the top right-hand corner, ensuring you are on gallery view. With this view, you should be able to see all the participants in a grid view to ensure that all video participants can see one another. During this meeting, we follow the same rules usually applying to opening statements and the rounds of questioning of witnesses during our regular meetings. Each witness will have up to 5 minutes for an opening statement, followed by the usual rounds of questions from members. And so now, I'd like to welcome our witnesses from the first panel, and from the First Nations Health and Social Secretariat of Manitoba, Amanda Miyawasagi, I'm sorry, Amanda, I practiced earlier, but I'll get it right this time. Amanda Miyawasagi, Director of Intergovernmental Relations, and from the Cellule Stratégique COVID-19 de la Nation Inuit, Chief Mike McKenzie, Jean-Claude Therrien, and Dr. Stanley Vollant. Ms. Miyawasagi, you now have 5 minutes for your opening statement. Please go ahead.
Okay, good afternoon, everybody. Can everybody hear me okay? Perfect. I just want to thank you all for the opportunity to present to the Standing Committee today. As mentioned already, my name is Amanda Miyawasagi. I'm the Director of Intergovernmental Relations for the First Nations Health and Social Secretariat. Today, I'm addressing you from Treaty 1 territory, the ancestral and traditional territory of Anishinaabe peoples. I'd also like to start my comments by acknowledging the Manitoba First Nation leadership who have responded swiftly and very effectively to the growing threat of COVID-19 despite limited resources. Our leadership here have been very proactive in preventing COVID-19 from entering our communities. We don't have any cases in Manitoba to date. And they've just done a really good job at anticipating risks and responding to these emerging challenges. With the help of leadership, our organization and partnering organizations, the political bodies that exist in Manitoba, have implemented a very strong and collaborative process to support one another during this challenge, to share our expertise, to tackle broader, and to try our best to tackle the broader systemic issues. First Nations understand the critical nature of preventing COVID-19 outbreaks. The colonial legacy and the embedded racial approach to funding structures have definitely made First Nations more vulnerable to COVID-19 infection and its associated harms. This can be as a result of the higher burden of high-risk conditions, the lack of access to appropriate and comparable health and social services. We can look to the issues of the social determinants of health that can include insufficient housing, food insecurity, lack of adequate water infrastructure, which makes it very, very challenging and sometimes not even possible to adhere to public health directives. This is data from the First Nations Atlas report in Manitoba, which we will send as an attachment with our submission, has strongly demonstrated that the gap in health status between First Nations and the general population is growing and not closing. The COVID-19 pandemic has further exposed these inequities, as well as the potential risk that these inequities place Manitoba First Nations. Therefore, today we'd like to take our time to stress not only some of the gaps within the systems, but also to talk about some potential pragmatic solutions. So, as we spoke about earlier, with respect to the higher burden of high-risk health conditions, the poorer access to health services, these environments in which First Nations are placed put us at significant risk for COVID-19. Therefore, we're asking for the federal government to aggressively invest in self-determined and culturally inclusive wellness promotion efforts that are directly aimed at improving the social determinants of health so that high-risk conditions with respect to COVID-19 can be improved. A good example would be to look at the drinking water situation in communities. The food insecurity is particularly an issue in our remote and isolated communities here in Manitoba. Number two, because First Nations are placed at a disproportionate risk, we call on the federal government to provide sufficient investment in local and regional health services in order to equitably respond to this risk. This means increased investment in the work that First Nations are already undertaking while being under-resourced. This is inclusive of pandemic planning, mitigating risks that have emerged with the pandemic, increasing COVID-19 education, increased access to testing, increased access to any equipment that's required, such as the personal protective equipment and more. There needs to be strong advocacy to ensure that First Nations are at front of line in receiving those services. Further to that point, these types of investments need to continue long after a pandemic is done. So this needs to be a post-pandemic focus as well. Number three is with respect to data pertaining to COVID-19 is key to monitoring and evaluating emerging patterns and trends, and in supporting better prevention and management, especially in populations that are placed at high risk or are considered vulnerable. While some First Nations across the country are currently engaged in COVID-19 data collection and surveillance, Approaches and measures captured may vary widely across different jurisdictions. There's a bit of a patchwork of the data collection with respect to the different jurisdictions, both federal and provincial health service providers. Therefore, we are calling on the federal government to collaborate with First Nations in developing a nationwide First Nations COVID-19 data collection and surveillance system that is governed by First Nation and has respect for First Nation data sovereignty.
We're at time right there. So hold any further thoughts. I'm sure anything else you have to say will come up in our questioning round. Then we'll go to our next witnesses. We have Chief Mackenzie, Mr. Therrien, and Dr. Volant. And who would like to start, please, for 5 minutes?
Oui, je vais commencer. Mon nom est Mike Mackenzie.
It's Mike Mackenzie. I'm the chief of the First Nation of Watana. Can you hear me? First of all, thank you for the opportunity to speak to you today on behalf of the chiefs of the 9 communities of the Innu Nation in Quebec, representing a population of approximately 20,000 people. On March 22nd, we agreed to set up a strategic cell to mobilize us to respond in a concerted manner to the risk associated with the COVID-19 pandemic. We are accompanied by high-level medical and psychosocial specialists, and I'm here with Dr. Stanley Volant, an Innu doctor and surgeon who is one of our experts. He will also address you. We are convinced that the strategic unit has helped us to better coordinate our local actions. Like our ancestors, we have been avant-gardists. We have anticipated and shown innovation by mobilizing to better support us. Our collective leadership reflects our pride as Innu people. The health of our people is our priority, and we are committed to continuing the efforts we have. As elected officials on our territories located in the administrative regions of Côte-Nord and Saguenay-Lac-Saint-Jean, the vulnerability of our populations to the pandemic remains a major concern because of the high risk factors of a spread that could prove to be serious if we did not have the means to maintain the workforce we have in place as best we can to protect our communities. For example, we've chosen to keep our schools closed in all our communities by offering innovative learning methods and adapted pedagogical support. One of the central questions is, what arrangements does the federal government have in place to ensure the continuity of health and safety operations in our communities? Knowing that the epidemic is far from being eradicated, that herd immunity is currently unthinkable, and that there is no vaccine available for several months, we insist that a clear plan for the future in support of our local plans be developed and implemented with the involvement of First Nations governments. We ask that the federal government be able to support our measures through the following short, medium, and long-term actions at all levels, be it in health, social services, education, public safety, management, and protection of Nitassinan and economic opportunities. We are ready to move to the stage of gradual deconfinement, and we cannot ignore the need for federal government support for our community-owned businesses in order to protect our assets. Our economic levers must be maintained and supported to help bridge the gaps and keep the search for financial independence afloat. We must keep in mind that our realities are unique and that we must always fight the obvious. The specter of federal and provincial jurisdictions always awaits us in the roundabout, often delaying the obvious. In fact, political goodwill is the ingredient that makes it possible to anchor actions to make a real difference. As a nation, we have taken matters into our own hands, but we are also reaching out to argue that the current crisis must be used as a lesson to do things differently in the spirit of saving human lives. So thank you.
After Mr. Volant, Dr. Volant, Mr. Therrien, anything further to add for a minute, or shall we go to our questions? We're good to go? Okay.
Je laisserai la parole à Dr. Valland. Je laisserai la Dr. Valland.
I think I would allow Dr. Valland to intervene. Allez-y.
Okay, well,
my name is Stanley Valland. I'm a surgeon. I'm Innu here.
yes.
I am sorry. I hear the okay. I'm sorry. I hear the same the interpreter at the same time. So I'm Dr. Valland. I'm surgeon. I'm a physician, and I'm also the counselor for the Innu cell for COVID-19. I don't have time to talk to you, but the what we want from the government federal is to have 500 to 1,000 testing possible to do our tests in our communities to prevent the second wave of COVID-19. So that's all the time I can have. I will answer you in the question period.
Thanks, Dr. Valland. And we will have time through the hour to get to any of the issues that you missed on. So right now, though, we'll go to our 6-minute round of questioning, and we'll start off with Mr. Zimmer. Bob, go ahead, 6 minutes.
Thank you, Mr. Chair. And I'd like to focus my questions to Chief Mackenzie. My role in Parliament is the Economic Affairs Economic Development Agency critic. So I'm going to have a bit of an economic lens in my questions to you. I hope you're well, and I trust you're well. It looks like you weathered the storm of COVID personally okay, Mr. Chief Mackenzie? Can you hear my questions, Mr. Chair?
I heard you. The Chief, he's got his mic open now. Chief, go ahead.
Yeah, sorry, Chief. I just asked a question. You must not have heard. That's okay. I just wanted to know how you're doing personally through the COVID crisis. Have you been well?
Ça a été très lourd, hein? Ça a été beaucoup.
It was very.
It was a lot of.
It was a lot of pressure. There was a lot of disagreement between the provincial and federal government. We had to fight with the provincial government. Everyone was passing the buck in the heart of the pandemic. It was hard to get some testing equipment, at least 3 to 4 weeks. We had to run after provincial or federal institutions. So we had 8 cases of COVID here. So in any case, it was very intense. We've worked 9 weeks in a row, 60 to 70 hours a week. Regardless, we took into account the respective realities of First Nations.
Again, Chief, with the lens on economic development, I guess my concern has been brought up by various guests already. It was about what are the next steps? Because I've heard, you've mentioned about testing, and that's where I'd like to go too. A lot of us are asking questions, even Dr. Valland. I think the next step, and a lot have argued that the next step is really to have adequate testing so we can kind of get back to that new normal of COVID, so our economies, people can get back to work and things return to as normal as possible. And I guess I would just ask you, we've also heard from other witnesses too about a lack of PPE. It is the jurisdiction of the federal government to provide PPE to Indigenous communities. And although we've been told that the PPE is available, we've heard from many that it's been difficult to access. I've seen in my local bands up in my neck of the woods in northern BC that they were left scrambling when they had some cases. I guess And it sounds like you've already affirmed that too. You've had some struggles getting tests and getting equipment. I guess from now on, what's the plan? What do we need to do to get back to normal as much as we can in our Indigenous and Northern communities? What is lacking, and where do we need to be? Let's go to Mr. Vallant. Please go ahead. Or Dr. Vallant.
OK. Bonjour. Est-ce que vous m'entendez?
Can you hear me well? Is it possible to translate to? So you have to be aware that the COVID-19 crisis will last for months, and our communities will have to face this epidemic and those risks over the last weeks and months. So it's very important to keep our populations safe. We have to send promotional message, wash your hands and all. What we will really need would be to carry testing. We need swabs, a great number of swabs, because several communities in Montreal or Quebec, there are already 6,000 deaths in Canada, for more than 4,000 in Quebec. So a lot of people in our communities, even in Quebec and in Montreal, could be affected. There were 10 cases in Innu communities. The danger is that after the reopening, after the end of the lockdown, maybe the virus will penetrate our communities. So we do need testing capacities for these newcomers. We've made some stats with public health experts and epidemiologists. We are 20,000 inhabitants here, and we would need 500 swabs a month, and this should be provided by the federal government. The federal government should help us protect our communities. And in the fall, when school resumes, a lot of our kids go to school, and they should benefit from the education program. Education is at the heart of social determinants of health. So the federal government should support us and help us find some lockdown spaces so that we could install those who have been affected in these temporary shelters.
For the response, and we'll go on now for 6 minutes, please, Mr. Van Couverden.
Thank you very much, Mr. Chair, and thank you to the witnesses for your for providing your insight and perspective today. We can only make good decisions as a government with good feedback and perspective and the insights of people who have been impacted by COVID-19, and your feedback is essential. So thank you very, very much for that. Just recently, we had Ms. Lorraine Whitman, president of the Native Women's Association. She came to the committee and talked a lot about the impact that this had on vulnerable populations within Indigenous populations like women and children, the elderly, and LGBTQ2S. And I was wondering if perhaps Dr. Vallant first could just provide some insight on how information gathering specifically is challenging with more vulnerable groups, and how the federal government could help in that regard.
À la cellule, à la nationale Innu.
In our strategic unit, we make decisions and we monitor the situation, and we've realized that there is more psychological distress than social distress in our community. We were very vulnerable before the pandemic. We're just as vulnerable during the pandemic, and we will remain vulnerable after the pandemic. Experts have told us that the issues will be exacerbated because youth are not going to school. And in fact, there will likely be an increase in violence that children experience at home. And in fact, we already know for a fact that women are experiencing more domestic violence during this crisis. We need more funding for social action within our communities during this crisis, which will be ongoing for months to come. I hope that the pandemic won't cause too much irreparable harm, for example, such as suicide.
Madame Miyawasaki, the same question, if I could, with respect to the impact specifically on women and other vulnerable populations in your community or in communities that you've heard from or worked with over the last couple of months?
That's a really great question. I think one of the, underserved population is our off-reserve First Nation membership. And that's a gap in terms of a lot of pressures faced at the First Nation community level to respond from reserve, even though there isn't the adequate funding that's provided there to provide on-reserve residents with adequate assistance. So that's kind of one of the vulnerable populations that we're hearing about. Our data collection process in collaboration with the provincial government is to try and accurately track those types of people. So the data sharing agreement that we've created with the province allows us to know all First Nations, whether they're on reserve, off reserve, and that'll allow us to tailor a better response and to have better surveillance and a better, appropriate health services will be provided.
Thank you. Chief Mackenzie, could I ask you for some insight on how this has had an impact on vulnerable populations like women and children, the elderly, and LGBTQ2S?
Premièrement, je pense que
many are vulnerable, but beyond that, a huge issue that we've been experiencing for at least 20 years is lack of appropriate housing. So, in a situation of viral spread, it is very hard for First Nations. We don't have any places for people to isolate. First Nations in Quebec are also affected by this. In our housing units, there are on average 5 or 6 inhabitants in one single housing unit. So it might be a good idea for the government to invest in that. For several years now, First Nations have been trying to advocate for a better housing situation. In some communities, there are maybe 400 housing units, and in others, there are maybe 50,000 housing units that are needed for Innu. And this will be important to address in the years to come. And elderly people live in these crowded houses with the rest of their family, and we know how vulnerable they are. And they already have pre-existing health conditions.
I've had the pleasure and honor of getting to know Valerie Courtois from the Innu Nation over the years, and just thought I'd say that the work that she does with youth and with a lot of different other vulnerable populations is really inspiring, and I look to her for a lot of insight. Mr. Chair, if I have time to go to Monsieur Thierry Pinette.
No, I'm sorry. You're right at time right now.
Thank you very much. Thank you very much for the insight.
And coming around now to Bloc Québécois, Ms. Gill for 6 minutes. Go ahead, please.
Merci, Monsieur le Président.
Thank you, Mr. Chair. Thank you, Chief Mackenzie and Dr. Vallant. I have questions for you about what we're experiencing now, what we have experienced in the past, and what you will experience in the future. So first, Dr. Vallant, you spoke about psychosocial needs and issues among First Nations and Inuit communities. Could you tell us what action we should take right now during this stage of the pandemic? What do you need right now? Well, As for psychosocial issues, we would appreciate an increase in federal transfers to our communities. A lot of money has been spent in general in Canada to address the COVID-19 crisis. I feel, however, that the funding received by First Nations is seriously inferior to what the rest of Canada is receiving. And I think we have major health needs. Indigenous peoples living on reserve and off reserve have major health needs that are often underestimated. And we have so many comorbidity issues, obesity, diabetes, hypertension. And many of our members live in multi-generational housing with multiple generations of their families. I just really think it's a shame. I think it's a shame that we have received so little funding in order to prepare for and deal with COVID-19. It's just insufficient. I would ask the federal government to do more and to do better to help First Nations so that we are not decimated by health or psychosocial crises in our communities. Mr. Chair, may I ask my next question? Thank you, Dr. Vallant. So, if I've understood you correctly, you feel that proportionally speaking, you are not receiving enough funding, and you feel that funding should match needs. And as Chief Mackenzie said, these needs are urgent, especially when it comes to housing and infrastructure. Now, here's my question. Given what your group, your strategic unit, has been working on, and thank you for everything you do to help your people, could you tell us what the government should do to take action? What is urgent right now? What should the government do immediately and quickly in order to prepare for a possible second wave of the pandemic? My question is for whoever would like to answer it. Well, I will answer. There will be a second vague, and there will be a third as well. So a second and a third wave, that's for sure. And if we look at past pandemics like the Spanish flu, the second wave was even more devastating than the first. Now, we, Innu, have had only 10 cases thus far. We've had some luck. We set up our strategic monitoring and surveillance groups. We closed off our communities. There is something that really, really worries me. I am worried for First Nations and Innu communities. I am worried that the second wave will hit us and that it will be even more dangerous and widespread than the first wave. I would like the federal government to work with us hand in hand. I would like all governments to work together as partners in order to not suffer from jurisdictional issues. Yes, of course, we must work with you because only First Nations know what is best for First Nations. Now, a next question. When it comes to reopening the economy, now, of course, there will be a second and a third wave, but could you now tell us what we should do right now to help First Nations and Innu, to help Indigenous peoples in order to do what would be best for you in reopening the economy? So do you think that this could be an opportunity for young people to help out with reopening our economy? I would like to participate in this discussion about this topic. Ms. Miyawasaki earlier spoke about social determinants of health. That's very important. We need to take constant action in order to prevent devastation by a second wave or even by further waves. How can we do this? We can do so by investing in all aspects of social determinants of health, be it social or housing, education, we need to make strategic investments based on a global, comprehensive view of the issues at hand. Now, we must be able to act preventatively rather than in reaction. Because if we don't take preventative action, then all of a sudden a problem hits our communities. For example, right now we are dealing with party drugs and synthesized drugs that have made their way into our communities. So when we start reopening, well, other problems will resurface just as they were.
For time, I want to move to our next questioner, but I'm sure we'll reprise this topic throughout our discussion. Ms. Kakak, you have, just before I give you your 6 minutes, Ms. Miyawasagi, I understand you're having an interpretation problem. Perhaps you could click your button onto the French side to hear that.
I don't see that as a menu option, but I have staff that are assisting me, so I should be able to proceed.
Okay. And let us know once again if you're having problem. Now, I'm sorry, Ms. Kakak, would you go ahead, please, for 6 minutes?
Matna, thank you, Chair. Just a quick shout out to our tech team and our interpreters for doing their best to keep us on track. Thank you for all the witnesses for presenting and sharing your wonderful knowledge with us. It's so important to hear all different voices from across the country. My first question is for Ms. Miyawasagi, I hope I'm saying your name right. We've heard from a lot of other witnesses that communities are not always being kept informed about how much testing is being done and how data is being collected. Has this been your experience, and what kind of impact does a lack of data sharing have on your ability to operate? I'm going to ask that we try and hover at about a minute for responses because I have a time.
Okay. I'll answer now. Fortunately for us, and maybe a little bit unfortunately, we had the H1N1 experience of 2009. So there's been a lot of intergovernmental collaboration and experience that could be drawn on. Therefore, we were able to move quite swiftly with respect to developing a data sharing agreement that would allow First Nation identifiers, which gives us real-time data to develop a better response in terms of the numbers that we're seeing to identify some potential trends. So for us, it's been a really good experience, but where this needs to continue. This is not just data collection on COVID pandemic. There's a lot of other pressing and emergent health issues that this type of collaboration needs to be entrenched and sustained throughout government processes with First Nations.
Absolutely. Thank you for that. My next question is for Chief Mackenzie. What has been your experience in the delivery of personal protective equipment and other resources to your community? Were they what you expected, and did you feel that you were able to have a say in what communities needed? Sorry, this question was for Chief Mackenzie.
C'est sûr, au niveau des équipements sanitaires.
When it comes to equipment and sanitation and hygiene equipment, it took quite a while for us to receive the equipment that we need in all of our communities. There was a lot of difficulty among regions in Canada to obtain equipment.
We have done everything to prepare people to face the pandemic, despite all the circumstances we have been going through. This crisis, we have faced it similar to other things we went through we do have a certain level of experience within the First Nations, but as far as equipment, it was hellish. There were too many waits. We had over a month and a half, maybe 2 months of a waiting period before getting the right sanitary equipment for First Nations.
My next question is for Dr. Vaillant. I don't know if I'm saying your name correctly. In Nunavut, and I'm sure it's similar for your communities, have now been waiting months for care that is deemed non-essential. Are you worried about the long-term impacts if people can't access basic?
Oui, j'ai des inquiétudes par rapport.
Yes, we have concerns in relation to the usual treatments. I'm a specialist in cancerology at the Notre Dame Hospital, so several people in Quebec are waiting these tests and treatments due to the pandemic. So there will be some long-term consequences surrounding the especially mortality rates for cancer in Quebec. A lot of people have not been tested. Follow-up tests for kidney disease, retinal problems. So these obviously will bring about long-term consequences flowing from the pandemic. But it's a general situation throughout the country, throughout Quebec. In Quebec, we are at the very epicenter of this, or at least one of the major epicenters in North America, so things are even harder. People cannot travel. The problem is when they're trying to travel to consult a specialist in Montreal or Quebec, they have to be confined because there is this risk of contaminating other members of the community. So that does raise some significant issues.
I think I have about 30 seconds. So, Doctor, if we can continue, can you talk a little bit about delivery of mental health supports and some of those barriers at this time?
Yes, there are several people in the psychosocial work in the community, but we've seen an increase in stress and also in drug addiction. We need additional resources to assist the community to maintain their heads above water, given all of these psychosocial impacts flowing from the pandemic. Yes, we do require additional assistance for these people.
Thank you very much. And we're moving on now to 5-minute round. Mr. Viersen, please go ahead for 5 minutes.
Thank you, Mr. Chair, and thank you to our witnesses for being here today. I'm going to start with Ms. Megwigi. Just talking about, I was just looking at the background and the mandate of the First Nations Health and Social Secretariat of Manitoba, and it seems like the planning and developing of a unified health system in Manitoba. And I was just wondering, how is that going, and have you seen that improve during the COVID, given the fact that a Manitoban's a Manitoban, regardless of where they live?
I appreciate that question. I think right now, because there's a threat to the general public health, there's always political will to respond to First Nation emergencies. So when an emergency happens, such as H1N1 and this pandemic that we're going through, governments are quick and swift to react. That type of reaction needs to continue when there's other pressing issues. So fortunately, right now, during the emergency and the pandemic, we do have a strong intergovernmental response and collaboration. But that needs to be formalized, and that needs to be ongoing to continue addressing all of the public health issues beyond pandemic response.
One of the areas that we've seen is that protective equipment getting into northern communities has been a challenge. Do you have any examples of that in your area? And do you see it differing from community to community?
So there is a shortage of PPEs within our communities. We do have adequate supplies for the nursing station. It seems that FINIP is very good in responding to that request, but we do have shortages in our personal care homes, for example, which we know the elderly population are at an increased risk to COVID. So it's very important that there's an appropriate number of PPEs. We also have people that have ongoing addictions issues that require daily medical travel for some harm reduction medication, for example. They're traveling often without PPEs in confined spaces. So most definitely, this is why we say it's imperative that First Nations are at the top of the list for these type of materials, given that we don't have adequate primary and public health care available at the community level.
Thank you. Is there a difference between if it's delivered provincially or federally? Are you seeing a difference in the availability of these materials at all?
Well, I think the collaboration has been very fruitful in terms of trying to determine whose role and responsibility it is to advocate for First Nations and their PPEs. So the province does provide some PPEs to some of our health centers and communities, but moreover, it's the provision of the federal government, and those numbers need to be forthcoming with respect to a potential second wave. You know, are we appropriately ready for it, given that there's a shortage right now?
This may be a little out of your area of expertise. Many of the communities that we deal with are fly-in only communities, and given the fact that due to COVID, many people just aren't traveling anywhere. Do you have any intel on the flights and the aircraft or the airlines, the Northern Airlines, how they're doing?
So I know that they've instituted stricter safety and sanitization kind of regulations. I know that First Nation or professionals that are flying into First Nation communities are screened and that they're flown in on a separate charter to ensure that there is no contamination by any visiting staff. But there is a lot of anxiety right now with respect to provinces opening up borders and reintegrating businesses. It's important that First Nations are supported in keeping their borders closed, should that be something that they choose, and that First Nations interest can no longer be placed secondary to industry and economic development priorities. And we saw an example of this with the hydro blockade the last couple of days in Manitoba. You know, partners need to communicate with one another and provide those necessary assurances for safety.
Thank you. Chief Mackenzie, do you have any comments around the airlines that are supporting your communities and whether they're remaining viable?
Very briefly, 10 seconds left.
Oui, c'était très important.
Yes, it was quite important to have some airline controls. There are so many hydroelectric plants throughout the Innu Nation, mining concerns all over the place. So I think we have airports, whether Sept-Îles, Saint-Pierre, everything surrounding the First Nations. We often talk about the vulnerability of First Nations when it comes to health issues. We spoke about health determinants. I think it's important to have some supervision, some control, not just air, but also road, highway. We've taken initiatives in most First Nations to close or to have stricter controls of the roadways.
Right at time now, and we'll go to 5 minutes with Ms. Demoff. Please go ahead.
Thank you, Chair, and thank you to all of our witnesses for being here. I want to start by acknowledging that I'm on the traditional territory of the Mississaugas of the Credit First Nation, and I want to start a little bit talking about jurisdiction, because last week we had the BC First Nations Health Authority with us, and Ms. Meiwasage, you sit on, as Mr. Viersen mentioned, the First Nations Health and Social Secretariat in Manitoba, and you've talked about collaboration there. One of the things, and I think from Chief Mackenzie's remarks, I don't think they're having the same kind of collaboration in Quebec that we've seen in BC and in Manitoba. On the data, that's something that's come up repeatedly from witnesses, is being able to determine the impact off reserve for Indigenous peoples in Canada. And you mentioned that there is data being collected in Manitoba. How did that come about, and how well is that going in terms of the data collection?
Okay, so it was a data sharing agreement that was negotiated between the First Nations Health and Social Secretariat and the province of Manitoba. And so basically what it is a First Nations identifier. So once a person tests positive for COVID, they're asked to either self-declare or identify as First Nation. That gives us real-time data in terms of where these people are from. It allows us to communicate back to communities that there is possible infection so that any kind of contact tracing needs to be made. But more importantly, we're getting that information in terms of off-reserve data. In Manitoba, approximately 40% of the population do live off-reserve, so that's a huge amount of people that are requiring sometimes extra response and services, and so that allows us to see that with this process.
What are you seeing in terms of the data for off-reserve? I'm just curious in terms of the rates of COVID.
So right now we know that there is no COVID positive cases on reserve. We have some cases of First Nations off reserve, and they are requiring, they're having higher rates of requiring hospitalization, which kind of gives us an indication that they're a vulnerable population, which is why this kind of data is super important so that an appropriate response can be made.
Do you have anything you could send to the committee? Because I think you've sort of verified what we inherently believe, but without that data, it's hard to develop policy as a government. What about on reopening? I'm going to ask both you and Chief Mackenzie to talk about that, because as the province reopens, it's really important, as you were mentioning, that we include everyone at the table. And we don't want to, you mentioned there's no cases on reserve. We don't want that.
Important, je pense.
I'll start with Amanda and then I'll go to you, Chief. Is that okay? Go ahead, Amanda, and then I'll go to you, Chief.
So kind of just as mentioned, I think it's important to support First Nations where they're at with respect to their readiness to open their borders. It might be a little bit later than what's prescribed by provincial notions. And I think that the ability to keep COVID out of our communities was a swift response to close their borders and to ensure that community safety is a priority over any kind of resource development or travel adjacent communities that may traditionally require that road.
Are you being included right now?
In some regards, yes. And I think it's certain partnerships, for example, like the hydro situation that I brought up, where communication probably could have been better and assurances made to avoid those types of disputes. But right now we are being included in conversation.
And then Chief, I'll turn it over to you. I only have about a minute left.
Yes. In the Innu Nation, we don't really have any data for the off reserves, but there is one thing that I would like to point out to all the MPs. Dr. Stanley Volant is a surgeon. He worked in setting up a health network in Quebec, and it was very important for the Innu Nation. I think it's important in terms of public health to come up with programs to better assess things. As far as the First Nations are concerned, the data are often quite limited. And people like Stanley Volant in Quebec, I suspect there are Indigenous doctors that can also add their voices to these assessments. In the second wave, we should start making preparations. We should assess the vulnerabilities of First Nations. But amongst the issues we have, that ranks up there.
5 minutes to Mr. Dalton. Please go ahead, Mark.
Okay. Yeah, thank you. Just putting on the translation. It doesn't seem to be working. Est-ce que vous m'entendez?
Can you hear me? I might have I can speak French. I have a question for Dr. Volant. You've talked a little bit about it. I live in a suburb near Vancouver. In our region, we've canceled thousands of operations that were preventive for the heart disease, cancer, and others, so that we would be ready for COVID-19. There are consequences. I'm wondering, what are the negative consequences that you've been seeing? You've already touched on it. Have you seen a decrease for people that have medical issues? What can we do for those people and for your people? In Quebec, it's different than in the rest of Canada. That's where there are the most cases. There are 50,000 cases or 6,000 deaths in Quebec, for example, in Montreal. I'm a surgeon, and our surgery centers are only working at 25% capacity. People are suffering. There was already a waiting list that was a few months. Now it's over a year. It's going to be very difficult next year or this fall, so that we can help people that are suffering. People are calling me, and we have to choose with regards to screening for cancer. We were late on this. We have people that go in the hospital. They have an appendicitis, but it's a complicated case. There are delays because of people that are afraid of COVID-19, and delays because we have limited resources. In different Quebec regions, for example, on Côte-Nord, we've had less cases of COVID-19. So there are less effects, but these effects will last for years. How can you help us? We don't have enough nurses. We don't have enough funding for the healthcare system. It will take some time. For First Nation, the federal government needs to invest more so that First Nations have resources to help heal their people. Thank you.
So just with regards to transportation, I believe MP Zimmer was talked about that. But what has been the impact as far as reduction in flights? I imagine that there has been a reduction in flights in the north, as we've seen throughout Canada. But for prices of goods, for example, food and other needs. So are we noticing a difference? Is it putting more of an economic pressure upon the First Nations people? Amanda, if you want to speak to that, and aussi le chef de Innu.
So food security has actually been a long-standing issue with respect to freight costs. So this is further exacerbating that situation. We know that the quick economy of flights and the way they're done right now is to load them up quickly, clean them up quickly, and turn them around. That's going to change, and so that's definitely going to have impact in terms of adequate transportation to and from community, be it service providers or community members flying out for medical services and such. But definitely the prices has gone up. We're doing our best to try and work with the Northern Store and different levels of government to see like a price freeze to ensure that it's not going to have a bad impact at community level.
Mark, we're just about 15.
Merci. Est-ce que le chef...
Does Chief Mackenzie have comments to make? I'm looking at what's happening in Matimekush-Lacon. That was very hard for prices, even on the Côte-Nord. Costs of food have increased quite a bit. We have to take into account as food sovereignty in the First Nations this year on the North Shore. We haven't been able to go hunting, but that's a traditional hunt for us. But because of COVID-19, we weren't able to go. So the price of food is much higher since COVID-19 has started.
I'm sorry to interrupt, Chief. We keep running into timing problems, and I apologize for that, but we'll move on to our next 5-minute round with Mr. Pawlowski.
Thank you very much. So I think you can all agree that your communities have so far done fairly well with the first wave. And in fact, a lot of parts of Canada have done pretty well. The epicenters seem to be Montreal, Toronto right now, the big centers. But as Dr. Volon has said, there's very likely to be a second wave, a third wave. And where are these waves coming from? The residual disease that continues to exist in places like Montreal and Toronto. Now, having said that, and your communities really stand to be hit hard should they be affected in subsequent waves because of the inability to control this in places like Montreal and Toronto. So that being said, I'd like to ask specifically Dr. Vallon or Chief Mackenzie, do you think that they could be doing a better job in places like Montreal in controlling the pandemic? And specifically, I'm also on the health committee. Mr. Thériault from the Bloc asked at that committee meeting whether Montreal maybe shouldn't be considering mandatory use of masks and more aggressive measures to control the diseases in those places so it doesn't come back eventually to hit you.
Mr. Pawlowski, lift your mic up just a little bit and answers, please, Dr. Vallon, and please go ahead.
Bonjour, Monsieur.
Hello, Mr. Pawlowski. I agree with you. It's been good so far in Indigenous communities, but the second wave could hit hard. First Nations need to focus their attention. I suggest that Innu Nations keep their restrictions for travel, that they have testing capacity for everyone that comes back from the hotspots from Montreal, Quebec City, and somewhere else, so that they could be in quarantine until we get the result of the test. Testing is essential. It's very important. We need to have this capacity everywhere in Canada. We also need to have PPE in sufficient PPE. Health Canada has not given us enough of that equipment. At the beginning of the crisis, there wasn't enough in hospitals. I almost performed surgery without masks for a few days. Canada's capacity to produce PPE is now there. We need to provide PPE to First Nations. Testing is important. Also, health and education is very important for youth. We've closed schools until the end of June. We need to find a way to reopen schools and to improve education with tablets. We will need money to reopen schools, and we might need different ways to teach than in schools, and we will need the help of the federal government for this.
Chief Mackenzie, do you have anything to add as to the ability of places like Montreal to manage the transmission of the disease, and whether you think they're doing enough, given the underlying threat to your communities if they aren't doing enough?
No, not really. But I think we need to get ready for the second wave. When there will be an outbreak of COVID-19, whether in Quebec City or Montreal, they'll need to close their regions. We decided to close the roads, close access. We had rules for people that were going out of our region that had to quarantine when they would come back for 14 days. We should act faster when there are outbreaks in the second wave. That's important. We need to have quick tests as well. As Dr. Vallon was saying, when we will be deconfining, for example, if we reopen Road 138, when people will come back to the reserves or the communities, they'll need to be tested, we should mandate testing quickly for people that are coming back to the community rather than requiring the 14-day quarantine.
We're right at time, Mr. Pawlowski. Thank you. 2.5 minute round now. Bloc Representative Ms. Bérubé. Vous avez la parole.
You have the floor. Thank you, Mr. Chair. I'd like to thank our witnesses. The Innu Nation has mobilized against the COVID-19 pandemic. I'd like to thank them and congratulate them for their amazing management. I see what's happening in the communities in my riding. In Lac-Simon, they've had measures to stop the pandemic as well. My question is for Chief Mackenzie. Earlier, you've talked about barriers. Are there things that are preventing communities from following public health advice? Yeah, the issue is on data. So we can't name people because of privacy issues, but it's taken a while to get data on people that are affected by COVID-19. We should maybe improve this in the second wave that we will get. As I've mentioned earlier, we need to have a unit, a public health unit with First Nation. Often, we have people from our region in those units. We want to have public health on our side in our unit, in our First Nation units. Thank you. I now have a question for Mr. Terrien. Can you tell us if the deconfinement plan by public health authorities is too fast for your communities? Yes. In order to have a good deconfinement, we still need to educate people on the different sanitation measures. We're also very vulnerable as a community. We need to take into account this in the deconfinement. The Canadian system, the Quebec system, are based on economic principles to have the balance between health and the economy. We need to balance things between those two aspects of Canadian community.
Madame Bérubé. Ms. Gazan, 2.5 minutes. Go ahead.
Thank you, Mr. Chair. My question is for Ms. Mwasagi. You spoke a little bit about blockades in Manitoba with hydro. And we know that Indigenous communities across Canada have felt a need to use blockades to protect their communities as a result of many things you've already mentioned. Issues around overcrowded housing, access to clean drinking water. They also have communicated very clearly, I know in Manitoba, that sometimes their voice is not respected at decision-making tables. Can you talk a little bit about why it's important for Indigenous nations to have autonomy over these kinds of decisions and what we can learn from the Manitoba situation?
Okay, so I think First Nations and Canada in general are the only group of people who have experienced the devastating impacts of disease and pandemics like no other group. Therefore, they're in establishing these blockades. It's an attempt to keep disease and the opportunity for disease spread out. Particularly when we talk about the era of reconciliation, it's important to respect the self-determination of communities to respond to pandemics or any kind of emerging issues where possible. As mentioned, I think the hydro situation probably could have been resolved in a much better way with appropriate assurances and communication. So it's all about communication and inclusion of First Nations in these discussions. One of the issues that came up with roadblocks, however, that needs to be remedied is who is responsible for providing the costs for this. If we have a conversation about cost in the jurisdictional football, if you will, people getting punted back and forth between ISK and FNIB, that's another issue that needs to be addressed with respect to the blockades and roadblocks.
So how do you feel the government could better address it going forward? You mentioned jurisdictional issues. How do you feel the government could better address this so that we don't have this situation occur again?
So right now you have ISK that's responsible for infrastructure costs, like maybe the security costs, and then you have FNIB that's responsible for health costs. So communities are expected to write two separate proposals, submit two separate plans, when really it should be the government that works out these plans amongst themselves and determines who pays for what.
Thank you very much. And we're going back now to 5-minute rounds, and our next speaker will be Gary Vidal. Gary, please go ahead. 5 minutes.
Thank you, Mr. Chair. I want to just congratulate the groups here today as well for their information and also for the leadership that they represent. Ms. Mia Wasagi, and I hope I said that right. You talked early on in your presentation about the proactive leadership of the First Nations that you kind of work with in Manitoba. And there was an article this morning in a newspaper that talked about the importance of observing strict quarantines and preventing any traffic between the villages of the north and the south and all of this kind of travel restrictions and whatnot, and how that has been a success in Nunavik. This was this particular article, but in the context of Manitoba, I'm just curious, when you talk about zero cases as well, that how do you balance that challenge between restricting non-essential travel and the need for people to access essential services outside of their communities, because we realize the remote northern communities don't have access to so many things? And kind of what did you find in your experience in northern Manitoba about that kind of balancing act of trying to restrict but have access to the necessary services?
Again, it goes back to communication and really common sense. And so a prime example is FNIB making assurances that when they're essential service providers come in, that they're screened, that they fly in separate on their own chartered flight so that there's no risk of contamination through commercial airlines. It's assurances such as that allows us to safely receive service providers, essential service providers.
Just as a quick follow-up, maybe what was the response within your own communities as far as the restrictions from their ability to leave? Did you find them very frustrated, or were they accepting of that and acknowledging the need for that in order to protect them from the virus?
There was a lot of frustrations, particularly around the compliance of young people, but I think that's across the board for the general population. But as I mentioned, our communities have a lot of unfortunate historical experience with pandemics and disease. We also don't have primary health care available at the community level, and community members are aware of that. Therefore, they're aware of the need to, keep our protections high.
Thank you for that. Dr. Vallant or Chief Mackenzie, maybe I'll go to you with this question, and either one can answer. Could you maybe identify the challenges that First Nations communities face, or communities in your Indigenous communities in your region face, in setting up testing services, and what kind of supports have been available? What have the challenges been to actually getting appropriate testing set up in your northern or remote communities?
La problématique a été un problème de juridiction.
Well, it is a jurisdiction problem. The province provides the laboratory, the testing laboratory, to see if we're infected. And we need the swabs. And that's a great problem. There were some shortages in Quebec. Quebec was really hit hard with this pandemic, and everything was concentrated in Montreal, so the capacity to get swabs was limited in regions. I think the federal government has an important role to play in this regard, especially Health Canada, to provide swabs to First Nations who need them. In the North Shore, we don't have much access to laboratories, but the first problem is to have access to those swabs. If we can get the swabs, we can test our people, and then we can really reduce the propagation of the virus in our community. So the problem is a problem of jurisdiction between the provincial and the federal government.
Oui, ça a été aussi
Yes. At the beginning of the pandemic, there were too many discussions between the politics, be it the provincial or federal level. The best solution for us would be for better planning and to have a group between the First Nation, the province, and the federal government to see what would be the needs for the second wave, rather than having 3 or 4 conference calls a week. It was very frustrating for First Nations, especially at our level.
No problem. Thank you, Mr. Chair.
Okay, thank you. Ms. Zan, you're up now for 5 minutes. Please go ahead.
Okay, thank you very much. Can you hear me? Okay, I'm coming to you today from the unceded territory of the Mi'kmaq in Nova Scotia. Hello, and it's nice to see all of you. Thank you so much for your incredible presentations. And I am so deeply sorry that your nations are so concerned and going through so many different things. But at this point, I'm very glad to see that there have not been too many illnesses yet on reserve. And I really hope that the second and third wave does not hit you at all. We've seen what diseases like this can do to First Nations people and Inuit people, and we don't want this to ever happen now in this day and age. On the 15th of May, we had a presentation here at this committee from Ms. Hilda Anderson Peers, the co-chair of the Missing and Murdered Women Coalition of Manitoba. And she told our committee that youth mental health is a critical area requiring action, particularly since many Indigenous communities are dealing with mental health crises prior to the pandemic. We also had Ms. Redvers, who's the co-founder and executive director of the youth support organization We Matter, who explained to us that Indigenous youth are finding new ways to remain connected online. However, she noted an increase in anxiety, depression, suicidal ideation, and self-harm, hopelessness, and that she said the youth are turning to unhealthy coping mechanisms. So I would really like to ask if somebody can explain to me how the current pandemic is affecting the youth in your communities, and what we can do, what the government can do long term to address the mental health crises affecting many Indigenous communities and their youth. Could we please start with Mr. Terrien Panette? Could we start with you, please? And I'd also like to hear from Dr. Volant, if possible, and also Madam Mia Wasiki, if possible.
Merci beaucoup, Madame.
Thank you so much for the question. I will quickly tell you that I did work with the only treatment center in Eastern Canada for youth, the Walguan Center. And this center works in collaboration in order to identify vulnerabilities and threats. As you may know, Indigenous leaders are confronted with the demographic pressure coming from these youth. We have to propose alternatives when a youth reaches the age of majority. Our population is very active and will be active in society, and we have very few alternatives for these young people. What about the problem of consumption on the development of the brain? So young people are confronted or using very toxic substances that destroys them and put their future in danger. They have many dreams, and they should have dreams for the future, but unfortunately, in their immediate surrounding, the environment is very hostile. What I was saying earlier to another question as to what we need psychosocially, we actually need to avoid these problems. We need prevention. We need experts, specialized teams. We're talking about psychiatric services, about medication. So we need this medical approach to solve these problems. We need to intervene. The only program that targets Indigenous people is the oldest one. It's called the PLADA, the National Program for Alcohol and Drug Abuse. There's also what we call the WISAC. So those are the only programs that targets our communities. And during the pandemic, we didn't have access to the treatment centers, to group therapy. So there's a lot to be done. But what is common to all these problems is public safety. We need access. We need availability. We're out of time. Sorry.
I'm
sorry.
So sorry. I would love to hear from every single one of you. But we can continue the conversation.
We will. Mr. Zimmer, you have 5 minutes. Bob Zimmer, please go ahead for 5 minutes.
Yeah, hello again. Maybe we'll catch up where we left off before. This was a question to Chief Mackenzie, and it's been asked of some of my colleagues too by Mr. Vidal, and just about the testing regimen too and the availability of the test. I want to dig into that a little bit more. To really adequately test communities, and I'll say a credit to the Innu communities for, and Dr. Vallant too, for trying to stay ahead of this. We were concerned back in March when COVID was just breaking, and we had talked to the Indigenous Northern Affairs Ministry about preventative measures about how to keep the COVID situation out of these remote communities. And I think, again, a credit to those communities. They said, we're going to put up our own walls to make sure that this virus doesn't get into our communities in the first place. And I think, again, a credit to those communities for the reason why it hasn't been so pervasive in those Indigenous communities. But let's get back to the testing. What do you foresee as the need in terms of numbers in testing in the communities? You spoke a little bit about, I don't know what the availability has been. I think the numbers are still a little bit vague. Have you been able to see any of your community members tested for COVID? And what have you heard of in terms of plans for the future? Are there plans to test more? What does more look like? Is that tens? Is it hundreds? Is it thousands? So Chief Mackenzie or Dr. Vallant, please answer as best you can.
Je vais répondre là-dessus parce que
I will answer the question. Our medical team looked at the question of testing, and the number is about 3%. 3% of Indigenous populations per village for the whole Innu communities. So 1,500 for 20,000 inhabitants per month. And that includes those who have symptoms, those who come back to our communities, and we have to test the asymptomatic people to know the percentage of asymptomatic COVID in our villages.
Et probablement que ça pourrait aller plus haut pour mieux connaître.
So, 3% is a low estimate. It could probably be higher, and we need to understand the epidemiology of the virus in our community. And at some point, we would like to have access to serological testing that will be available soon. We want to know who has antibodies in their blood. That will, in turn, allow us to know when we have reached herd immunity. In fact, we would need upwards of 70% of our communities to have antibodies in order to have widespread protection from the virus.
So, Dr. Vallant, so 3%, is that what you aspire to? Again, just to be clear, is that what you aspire to, or is that what's already happened now? And maybe I can ask, what are the numbers of testing that's already happened as of now, if you know? Is it 3% or is it less?
C'est moins que 3%.
It's less than 3%. It's less than 3%.
We have less than 1% of the testing so far. It was probably due because of the lack of testing in Quebec. We had so many problems in Montreal that there was a lackage of testing outside of Montreal. So 3% would be at least the number that we would like. Should be maybe more, but at least 3% would be a good start.
And maybe I just see Chief McKenzie went offline there. So maybe just one last, probably I have a few minutes left. What do you think, other than testing, is necessary to get us back to normal? Is it masks? Is it social distancing measures, screens, those kind of things? Maybe just give us a snapshot of what you're looking at to get to that normal again.
30 seconds.
We have asked people to continue their hand cleaning, the physical distancing of 2 meters, and also we have asked our people to wear a mask when they are going out in public spaces. And the mask is, I think, is key in the process. So do
you have enough masks now, Doctor? Do you have the masks available to use if you require them?
Not enough, but our communities are making masks for our population. But it would be nice to have more funding to have more masks for our people.
Okay. Thank you very much. Thanks, Mr. Zimmer. Mr. Pawlowski, for 5 minutes. Please go ahead.
Wow, I'm back again. I didn't know I was going twice. So now I think the federal government's funding for First Nations, Indigenous communities in relation to this pandemic has been on an individual community basis rather than taking a more global approach. I don't know, do you think that was the right way to do it? Because I know some communities have more expertise than others. Some certainly, Dr. Volant is a bit the exception, the Innu community having surgeons, but some communities don't have a lot of medical expertise. Would it have been better to have taken a more global approach to find global solutions in Indigenous communities?
Je crois que oui, au Québec, il y a plusieurs communautés qui n'ont.
Yes, in fact, in Quebec, many communities did not have an Indigenous strategic unit like we have. Now, we've been very lucky because Innu leadership set up this strategic unit, but the Anishinaabe don't have such a strategic unit, nor do the Mi'kmaq, nor do the Atikamekw. Many communities don't have enough medical experts, and the government should absolutely have a more comprehensive approach to help all Indigenous communities, east to west, north to south.
Ms. Masawigi, I'm sorry, I'm murdering your name, but anyhow, maybe a response to the same question. Ms. Masawigi.
I'm sorry, you just cut out there. What was the question?
It was the same question as to whether we should have taken a more global response rather than leaving it to each individual communities to come up with plans.
It's hard to say. It's hard to know whether that would be a better approach. It's never been done that way in the past. But as mentioned, I think there could have been a streamlining of how proposals were requested from communities, that there was no guidelines in terms of, they said to submit a plan and people weren't sure what was eligible or ineligible. And so the fear was that there was a lot of time wasted with guesswork. There's also a fear of retaliation from our communities, from funders, for submitting ineligible costs. So there was a lot of uncertainty with how this was rolled out. And as I mentioned, there's kind of a bit of a jurisdictional quagmire between ISK and FINIB in terms of who's responsible for paying for what. And therefore, the onus was on communities to develop two separate proposals when really it should be flipped back to the funders to determine that in-house and to make a seamless single window kind of approach.
Do I have any time left, Bob?
2 minutes. 2 minutes.
2 minutes left. Wow. Okay. So let me ask something totally different that I haven't yet asked anybody. I know I'm a doctor too, and I've worked both in communities where we flew out women who were pregnant, and I've worked in communities where we flew in women who were pregnant. Anyhow, a lot of northern communities don't do their own obstetrics. They fly them down south. I would think that this would be a source of considerable anxiety. Not only are you going to a big center you're not used to, but now potentially being exposed to COVID-19. Does somebody want to address the situation faced by pregnant women having to go down south to deliver in these troubled times?
I just want to make a comment that this is a glaring a point towards the lack of primary healthcare services. Our people have to leave community to give birth. They have to leave community to pass away. And so that leaves a big gap of services where we're dependent on patchwork nursing station response. It is a compounded risk in our communities. Even when they get to Winnipeg, they're expected to deliver alone due to COVID restrictions at the hospital. So it is a long-standing issue that can be resolved to ensure that people are supported or that appropriate birthing services are brought back to community.
Dr. Volant?
Je suis d'accord avec ce que Amanda a dit.
I agree with Amanda's answer. I think that Indigenous communities should absolutely be more autonomous and should have more medical services. Now, we've had a lot of luck because Innu women in fly-in, fly-out communities, they go to Sept-Îles, which is not too far. They go there to give birth. And so they can bring other members of their community with them.
Thank you very much, Dr. Volant. 2.5 minutes now. Ms. Gill.
Merci, Monsieur le Président.
Thank you, Mr. Chair. Now, I've heard many times that we need to stop jurisdictional optional obstacles because that makes crisis response even more difficult. Do any of our witnesses have any solutions to propose? Do you have any ideas about ways that we can act faster and be prepared and ready in the future? Thank you. Within our strategic unit, we've been able to work with provincial and federal public health officials. I think that's a great way to work, a great way to operate. I think that this is a shining example of communication. And as I said earlier, I hope that this excellent communication continues after the pandemic. Intergovernmental communication is so important. That's a great model. I have a quick comment about our experience. Often, unfortunately, we only act reactively. There's a crisis. We get ready. A house starts catching on fire. We send firefighters. But what are we doing preventatively ahead of time to prevent problems? Indigenous communities only traditionally receive funding as soon as a problem arises. We have not received funding to be preventative, to prevent problems from occurring. We need to anticipate problems that could arise and act preventatively. Dr. Volant has told us a success story about great communication leading to great results, and we need to carry out this model again in the future. It has been successful because of coordination, teamwork, collaboration, and that doesn't cost a cent. All it takes is will. The will of many actors, groups, and governments to work together to do good work.
2.5 minutes. Ms. Kakak.
La sécurité civile.
Merci, Chair. I'm going to pass this time on to my colleague, MP Goodson.
Yep.
Yes. Thank you, Mr. Chair. My question is for Ms. Mawasaki. Can you share a little bit about the work that's been achieved by the First Nations Health and Social Secretariat of Manitoba in support of First Nations data sovereignty? I want you to discuss and maybe share a little bit about what systems you currently have in place, and maybe share a little bit about how you feel the federal government could better support the health research you're doing.
Did that freeze? Sorry.
Lost the feed.
I think if you answer with the point that she got to would be great.
Okay, I think I have enough to answer. So we need that to ensure that there's ongoing investment into First Nation data centers. The data sharing agreement that we were able to negotiate with the province was only a result of a strong data governance behind us with respect to First Nations. We always ensure that the OCAP principles are paramount so that there's ownership, control, access, and possession by First Nations. That's the only way to ensure that there's reliable data based on our understanding of the different data sets that do come in. We have long demonstrated successful governance of this data, and it therefore needs to be supported. Opportunities for data governance needs to be opened up. Right now, it's kind of bottlenecked to a lot of the academic institutions, and that opportunities need to be opened up to, say, centers such as the First Nation Information and Governance Center.
Definitely. And just a quick follow-up, apologies, Chair. Leah let me know that she did get kicked off her feed. Can you give us a little bit of insight into if there's overlap or significant gaps between provincial and federal supports? And I think we're at about time, so if you could follow up with that would be absolutely great.
Okay, please send some follow-up information to us. We'll move on to our 5-minute round. Once again, Mr. Viersen, you have 5 minutes. Go ahead, please.
Thank you, Madam Chair, or Mr. Chair, and thank you to our witnesses once again for being here. When I was previously asking a question there, I'm not sure if we still have the chief with us here, Chief Mackenzie. I was just you got cut off a little bit early. You were explaining how northern communities with the fly-in and how the airplanes or the airplane infrastructure needs to be supported up there. You talked a bit about how that is done. I was just wondering if you have any perspective on, are those airlines remaining viable given reduced numbers of flights? I know just trying to get to Ottawa for next week is a challenge from northern Alberta, never mind from northern Quebec or northern Manitoba. Just wondering if you have any insight on what the state of affairs is in terms of numbers of flights and whether those airlines are remaining viable.
Premièrement, je pense que c'est important.
First, these airlines, flying from Sept-Îles to Metimecush costs $1,200 per.
So we do have rail transport belonging to the three communities, Metimecush, Latcham, and Watikamash also. But with this pandemic, there have been some stoppages in the transport system between the two communities. And now we're asking certain people not to do rail transport either. So for flights, that has always presented a problem as far as these regions are concerned. To go towards Sept-Îles or Quebec City, there haven't been that many flights. I think Air Canada shut down all its flights in the North Shore, and you had the Provincial Airlines that did a few flights between Quebec City and Montreal.
Communities still continuing to be serviced at this time? Are all of your communities continuing to be serviced at this time, Chief Mackenzie?
Vous parlez encore de...
Are you still talking about air service? Yes, if you're referring to air service, yes, they came back for rail transport. We will begin rail transport maybe in the next week of June. So there will be rail service to Sept-Îles. We know in the north there has been no COVID-19 cases in Matimagouche in the north.
Thank you. Ms. Miawis-Guy, continuing on in Manitoba, you were talking about the interlay between the provincial and federal health services that are laid out there. I'm just wondering a little bit around individual communities. I know I represent 14 Cree communities in northern Alberta. Many of them have blockades at the end of the road to go into them, with people monitoring who's coming and who's going. Is that a similar case in northern Manitoba? And how well has that worked in northern Manitoba?
1 minute.
You're still on mute, unfortunately.
I think it's in fact Manitoba First Nations erected their blockades long before there was a provincial public health directive, and so I think that was key in stopping the spread of COVID in our communities and keeping it out. It's been a strict lockdown process with coordination amongst air carriers, people coming in, essential service providers, with assurances that people are screened before coming in and that they're deemed safe.
Thank you.
Just about at time, Arnold.
All right. Cede the rest of my time there then.
Okay,
Mr. Chair.
10 seconds. I don't know if you can get an answer in that time. Mr. Batiste for 5 minutes.
I just want to thank all of the participants and witnesses that we've had today for sharing their stories with us. And I know that you've made it pretty clear that, when we talk about returning to normal, that normal for First Nations communities and First Nations Reserve isn't the normal that we know in Canada in many places. And a lot of times we overlook some of the aspects. And Jean-Claude, myself and yourself were on the AFN Youth Council, and I want to give some time to talk about what are some of the challenges that the youth are seeing in Indigenous communities today. And if Jean-Claude gives any time, I would also like to ask Ms. Miawis-Guy to also comment on what are the challenges that the youth are going through. And if there's not time, please submit something in writing so we can make recommendations and be proactive, not reactive, Jean-Claude.
Merci beaucoup.
Thank you, Jamie. I'm pleased to have to work with you once again after so many years of collaboration at the national level, at the youth level. As I said earlier, the youth do bring about a significant demographic weight. The situation in Montreal is often surrounding senior citizens in senior homes. The young people want to have certain experiences. The young people are not made to be confined, to be locked away in their houses. So the psychological pressure of confinement has been quite significant in terms of the family setting. We did a poll to assess the water temperature or social temperature, and we saw the pressure was very high. But the first reaction was to shut down everything to protect oneself from this external force, which was the COVID-19. So this somewhat hid some of the other pressures the young people were facing. But these traumatic experiences, well, slowly people are coming out of that. And right now, we know it's a spring. The snow is melting. So what do we do as an agency or government to accompany them to develop good hygiene habits in areas where there is a significant use of alcohol or drugs? We also noticed that the violence became more prevalent. We know that the MDMA, some of these opioids that exist in the communities, they lead to very high-risk behavior. And there is an impact on the family network. If there is even one user that lives in a household, as Chief Mackenzie said, this person can negatively impact 10 to 15 people within the family. They upset everything within the household. Young people have to try to have the best experiences possible, have alternatives in terms of income security, and living their full potential. They too have a right to a better future. We're talking about coming back to normal, but we must be innovative. The future is probably going to be quite different from what we knew before COVID. Thank you.
Access to services after hours. So that's a really big gap in community. We also know that youth are really responsive to social media, internet technology. So counseling services are available and they are responded well to. Unfortunately, the issues we do have are around connectivity. And so at what point, will technology be considered as an essential service such as water and really be considered a human right, particularly with respect to education? With COVID-19, we are really well aware of the fact of the lack of youth and recreation, the boredom, and sometimes the mischief as a result is apparent through these types of situations. So there is a need for local, coordinated, and supported recreational services for young people.
Thank you very much. We're right at time, Jaime. So I'll go to a 5-minute round of questions with Mr. Dalton.
Yes, thank you. Just wondering, how difficult has it been for your people to just follow the health directives in their communities as far as the physical distancing? Has this been a real challenge? I know it is elsewhere, but I'm thinking specifically in your communities. If Ms. Mswagi, if you could respond to that, and après ça, Chef Mackenzie, si vous pouvez parler de ça aussi.
And Chef Mackenzie, you can also talk about.
There's overcrowding situations, particularly in northern Manitoba. The ability to self-isolate poses to be a big problem, should that be a requirement. So we've had to set up isolation centers outside of the home to accommodate that. It's also been a hard directive to wash your hands regularly when you don't have potable water, and that there's only a limited amount of water, and that we have also had difficulties in accessing hand sanitizers in absence of having the ability to wash your hands. So that's a glaring gap that needs to be remedied.
Hey, Chef Mackenzie.
And Chief Mackenzie. Chef Mackenzie, I was just wondering, how hard has it been for the people within your communities to follow the health directives, the physical distancing measures? Is that really a major issue, or do you find that everyone is able to follow these directives? Yes, at the start of the pandemic, I think throughout the Innu Nation, I think we have 20,000 people, as I mentioned at the start, but we don't really have any cases right now. I have 3 out of 9 communities, we don't really have cases. I think within the First Nations, we are served by the Sûreté du Québec. It's significant to mention this. Most communities are still waiting to have their native police services, the indigenous services, so they can put in rules for COVID. At the start, it was hard to follow these directives, but I think the community backs us fully. We are always close to the people. We have in our TV, which allows us to directly get in touch with the community. So we also have a network, a communications network, SOCAM, which is quite useful. So public safety communications, I think it's been quite successful amongst the First Nations. Thank you.
Just wondering now about economic impact, especially with businesses, First Nations, enterprises, businesses, whether it be mining or in other fields. So just what has been the economic impact with these on the business side of things, specifically with their businesses, but also perhaps even stores and other venues, outlets, services that are offered for the community. If you could respond to that, that'd be appreciated. Ms. Miswagi.
So there is obvious impact with rising costs and the new way of doing business with respect to flying on the different restrictions. So it is costing more to run these stores. I think there's a really good compliance with respect to social distancing guidelines and such. But yeah, the cost of food is expensive. The cost of bringing in the equipment is expensive. So it's definitely having a negative impact on communities. But as mentioned, we don't want to put economic interest above First Nation security at any point, and that there's ways to resolve this given strong collaboration amongst partners and communication.
Thank you. Hey, Chef.
In 10 seconds.
Bon, ça va.
We were right at our time for the entire meeting. And so at this point, I would like to thank our witnesses. It's been a bit of a struggle with technology. Lightning blew out one of our clerks for a while, and I believe Ms. Gazan had some connection problems as well. So it's been a bit of a struggle, but we did get some remarkable evidence, testimony from our witnesses. And one of the things that I think we all take from this is that we're far from over with the discussion on COVID. So we'll take that as a direction. And thanks to Amanda Mia-Wasige, Director of Intergovernment Relations, and our Chief Mike McKenzie, Jean-Claude Terrien, and Dr. Stanley Volant. Thank you all. And I now declare this meeting adjourned.